This Good to Go segment is sponsored by Corewell Health, formerly Spectrum Health.
Corewell Health West, formerly Spectrum Health, is now offering Pritikin Intensive Cardiac Rehabilitation. It's a clinically proven program that provides comprehensive cardiac rehab for patients who've undergone a cardiac procedure or experienced a cardiovascular event. Well, here to tell us more about the program is Dr. Thomas Boyden, Corewell Health West Medical Director for Preventive Cardiology and Cardiac Rehabilitation. And it is good to have you here, Dr. Boyden.
Thank you very much for having me.
Tell me about this Pritikin Intensive Cardiac Rehabilitation Program. What is it?
So it's really a comprehensive program really aimed at getting people back their quality of life and leading a healthier life after they've had a cardiovascular event like a heart attack, or they've had medical procedures or surgeries on their heart like stents or bypass surgery or even valve surgery.
What are the benefits of this program for heart patients?
Absolutely. So there's several benefits, all based around what this program is, which is in part kind of an exercise-based program, but also very much educational about healthy behaviors as well as nutrition. And so the real benefits are that people are going to feel better. They're going to have a better quality of life. They're less likely to have future events. They're less likely to have the need for future cardiac procedures, and they're more likely to stay out of the hospital in the future.
Overall, better outcomes for sure.
Absolutely.
Is this program reimbursable through insurance or through Medicaid?
Absolutely. As long as you meet one of the qualifying diagnoses, this is covered by CMS, the Center for Medicaid and Medicare Services. It's also covered by pretty much every private insurance company as well. And those qualifying diagnoses are kind of what I talked about earlier, an event with your heart, whether it's a heart attack or unstable angina or a medical procedure like a heart stent or surgery like transplant, like valve surgery, like bypass surgery. And as long as you meet one of those qualifying diagnoses, it's covered by insurance.
And so is this something that that my physician might refer me to, or am I already in the care of a cardiac physician? How does that work?
Usually, if you've had one of these events or you've just had a recent intervention of some sort, you're typically under the care of a cardiologist or a cardiothoracic surgeon. And we always try to make sure that people are referred to cardiac rehabilitation after these events and procedures because it's known to help improve outcomes, like we already talked about. But in case like, you moved to the area or you had an event and there was some mix-up with follow-up, your primary care doctor could refer you to cardiac rehabilitation directly.
Got it. And where is Corewell Health offering this program?
Yeah, so our intensive cardiac rehabilitation program is offered at our main cardiac rehab center, which is here in Grand Rapids at 2902 Bradford Street, very close to the corner of Bradford and Beltline. And we really are trying to get most of our participants into intensive cardiac rehab versus traditional cardiac rehab because the benefits have been proven through the clinical research and they improve outcomes even above and beyond what our traditional cardiac rehab does.
That's awesome. I know you're planning some expansion to other locations.
Absolutely. So we hope to use this as kind of a model for our other locations, and we have several locations throughout the West Michigan area. And so hopefully we will start seeing those satellite locations open up intensive cardiac rehab as well.
All right. All good news. Folks, to learn more about Corewell Health West's ICR program, visit spectrumhealth.org and search cardiac rehabilitation. Dr. Boyden, thanks so much.
Thank you very much for your time. I appreciate it.